You matter, and completing the 2020 census matters to Decatur and Macon County. The 2020 census is critical for our community to get the funding that we need for job training, better health care, our schools, and services such as food assistance and housing. It's easy and it only takes a few minutes to complete. Go to 2020census.gov, fill out the 2020 census, and let your voice be heard today. Welcome to Speak Up, Speak Out, a weekly online forum to discuss issues facing our community and working towards ways to enact real, tangible change. I'm your moderator, Terrence Tad Taylor, radio personality, DJ on Hot 105.5, and essential skills instructor at Rich Community College, and now the new director of community investment here at the Community Foundation of Macon County. I have all of the jobs, okay? Topics weekly on Speak Up, Speak Out will include everything from community action, mental health, family communication, and more. You can catch Speak Up and Speak Out every Saturday on Hot 105.5 on our Facebook page, as well as nowdecatur.com. I want to take a second to thank those that make this forum possible each and every week. Crossing Healthcare, the Community Foundation of Macon County, United Way of Decatur in mid-Illinois, Newhoff Media, and the great city of Decatur. You, the audience, are invited to participate as well. We want you to speak up, speak out, submit your questions to speakoutdecatur@gmail.com or online at our Hot 105.5 Facebook page, on my TAP Facebook page as well, or nowdecatur.com. I want to introduce this week's panel. With no further ado, medical director, and she's on the board of the Community Foundation of Macon County, the first Black female, the first Black person ever on the foundation board. And she's a part of Crossing Healthcare, Dr. Dana Ray. And we have—
Good morning.
Good morning, young lady.
Can I make one correction?
Yes.
Judge Lisa Holder White is on the board of the
community. Okay. That's correctly. Okay, I got excited about you. I'm sorry. Yes, Judge Lisa is on the board as well. My apologies. And we also have President and CEO of Illinois Primary Health Care Association, Jordan Powell. How you doing, Jordan?
I'm doing all right, Terrence.
Hey,
how are you?
I'm fantastic, terrific, and great all day long.
Yeah.
And today we're going to talk about the racial disparities in healthcare. It's something that is major, especially with the pandemic happening. As we speak, it has not gone anywhere. COVID-19 is still a thing. So we're going to get straight into it. First question I have is, recently with issues of racism, discrimination, and long-standing disparities, especially being in our community, but now being in the mainstream consciousness, what ways do these inequities manifest in healthcare? Dr. Ray.
Okay, so you're saying the inequities in healthcare currently going on in a number of different ways. When we look at African Americans or Hispanics in our community, they have a higher rate of diabetes, high blood pressure, cancer rates than the general population. Also, especially with COVID that is going on right now, the individuals who are faring the worst are minorities. And so again, you're looking at, especially in the Chicago area, you're looking at the south side of Chicago, those neighborhoods which are faring a lot worse, which typically have a higher African American and Hispanic population. And even Dr. Fauci has made mention that we're seeing how the social determinants of health are playing out as far as the disparities in health that is being played out with COVID. And so this is something that has been looked at for years in healthcare, but now it's really being highlighted more now than ever before.
Jordan, same question for you.
No, thank you. I think Dr. Ray is spot on, and I just want to start out again thanking you, Terrence, for the opportunity to be on your platform here. This is such an important discussion. Also, congratulations on all of your success. I feel honored to be here speaking with you and Dr. Ray today. But as I said, Dr. Ray is spot on, and for those that know me and might be watching or listening, you know that I try and simplify things as much as possible, and I see the inequities manifesting themselves in really two buckets. One is healthcare access, and the other is healthcare outcomes. And when I'm talking about healthcare access, that means, do I have health insurance? Do I have access to a primary care provider or specialty care? Do I also have access to other community services that are going to impact my health? What Dr. Ray referred to as social determinants, right? And the second being health outcomes, meaning simply, what is my life expectancy? Am I more likely to have or develop chronic conditions like diabetes or hypertension? And if I develop those chronic conditions, are they managed appropriately? And we see, not only in Illinois' healthcare system, but nationwide, these huge disparities that exist based upon your skin color or your zip code. And a few examples of that, by the mere fact that you're African American, and Dr. Ray touched on this already, you're more likely to have heart disease, cancer, diabetes, hypertension. If you're an African American woman, you're 6 times more likely to die. If you're an African American woman giving birth, you're 6 times more likely to die than your white counterpart. In the city of Chicago, and there's a recent study done by New York University that shows that Chicago neighborhoods have the highest disparity in the country in life expectancy. So you could be in one zip code in a low-income community, and your life expectancy could be 30 years less than a more affluent white neighborhood just a couple miles away. It's absolutely appalling, but it doesn't just impact African American communities, also Latino communities. Latinos have really high uninsured rates, reaching up to 20%, which is, again, it's just really sad. So this intersection of race and discrimination and health and the inequities that exist is really apparent in the country today.
Yeah, and can I touch on something that Jordan just mentioned? Just recently, I think a year or two ago, there was a study that was done that Jordan has alluded to by the Robert Wood Johnson Foundation. And it actually, you can type in your zip code and you can see what your life expectancy is compared to other zip codes. When you type in 62526, which is predominantly the inner city of Decatur, versus a zip code in Mount Zion or Forsyth, you can see a 10 to 15 year difference in the life expectancy of someone who lives in 62526 versus someone who lives in Mount Zion and Forsyth. And so, we do talk about sometimes what's going on in Chicago, but this is occurring even here in our own community. Where you live matters, and it also matters as far as how long you're expected to live or what type of chronic conditions you're expected to occur.
And these are disparities that's been occurring since slavery, am I right? And the civil rights.
You're right. There's several books that I went through and reread with preparing for this discussion. Because number one, Terrence, I want to impress you with what I learned. But when you look,
impress me. I want to hear about it.
But when you look at how African Americans or minorities were treated as less than human, or 3/4 of a person prior to during slavery and even in the civil rights movement, those disparities were highlighted. One of the most famous, which has been circulating around here lately, and I want to make sure I get this name right, so I'm going to get my notes here, was Dr. James Marion Sims. So he is the father of gynecology. And he learned his practice, or honed in on his practice, by practicing on slave women, and sometimes without anesthesia. This surgeon then was able to practice on white individuals after he perfected the surgery on African Americans. That just highlights just one of the historical factors that has shaped healthcare in our community. And then even if you move up to the civil rights movement, or during the civil rights time period, you have the Tuskegee syphilis experiment that took place, where African Americans who presented to Macon County, Alabama, for treatment for syphilis did not actually receive treatment, but was told that they had quote unquote bad blood, that terminology came from, and weren't actually given medical treatment, but were just monitored to see what long-term effects of syphilis would have on the individual. And so these instances, and I've just mentioned two, and there's other instances that we can talk about, but how these two instances have set it up to where there has been distrust of the medical community. Also, when you include in the fact that there aren't very many African-American physicians present, and again, that is just another sign of systemic racism that was put in place to prevent African-Americans from getting in those positions, and even being able to be an advocate for African-Americans. And so we're just seeing it play out now. And you could say, well, that was back in the civil rights and back in the 60s and 70s, because the syphilis experiment discontinued in 72. But even when you look at New York, there was a study that was done on African-American and Hispanic boys. This is in the 90s. And so there was an injection of fenfluramine, which was done intravenously. It was done in small doses, but a study being done to determine if these boys would end up being more, having more issues with their behavior as a result of receiving this injection. Basically trying to determine if higher levels of serotonin or different chemicals in your body, if they're elevated, will they cause you to be more violent? And that is just one recent, again, in the 90s that took place. And so we can say, well, that's not occurring now. That's in a very distant past and it's not going on now, and we don't have this issue, but we do have this issue. And I'm gonna even let Jordan talk about how even when you look at the Affordable Care Act and its passage and how that has tried to help levy some of those changes to where we don't have these healthcare disparities.
Well, Terrence, I'm so glad you brought up going back to slavery, because I'm sure some people might be watching and say, oh boy, they're going way back to slavery and connecting it to current times. And I can understand why people might say, well, how can you make the connection? And one of the connections is, yeah, this stereotype of going back to slavery, of that Black people don't feel pain in the same way.
I was just about to say, I'm glad you brought that up. I've heard this, and it's still in medical books, like Black people can endure more pain. That's not true. I'm sorry.
Right. And I mean, and there was a study done on medical students in just 2016, so just a few years ago, that they still have that unconscious implicit bias that Black people don't feel pain in the same way. And we're talking about African Americans now, and if I'm focusing on African American women that have much poorer outcomes than white women, I mean, you can tie that directly back to slavery. There was also a piece of legislation prior to the Civil Rights Act that was intended to provide equal access to healthcare. It was the Affordable Care Act of its time back in 1945 during the Truman administration, called the Hill Burton Act. Okay, a lot of people don't know about this, and honestly, I didn't know about it until a few years ago, until I started researching it. The purpose of the Hill Burton Act in 1945 was to provide access to care to everyone, no matter what their race, their skin color, where they're from, and they're supposed to provide a level of free care. But what ended up happening is the law still allowed for separate facilities. So you had white healthcare facilities and you had Black healthcare facilities, separate but equal. I mean, let's be real, it's separate but unequal. Okay, that existed. It started in 1945, and that existed until the Civil Rights Act of 1964. In 1965, I'm sorry, I'm dropping some knowledge on you guys today, just giving you a little history lesson.
I love it. Keep it going.
Yeah.
Let's do it. Gotta educate.
1965, then Congress created community health centers like Crossing Healthcare to provide care to anyone regardless of their ability to pay. And the purpose was to serve specifically in, quote unquote, underserved communities. And actually at that time too, Martin Luther King Jr. was right here in the state of Illinois in Chicago fighting still for civil rights and equal rights for African Americans. And he made a speech around this time that community health centers were created, and he was speaking to a healthcare audience. And he said that out of all of the inequities that exist within America, that the inequities that exist within our healthcare system were the most shocking and the most human. So the history of Crossing Healthcare and other community health centers, which we represent now 390 sites in the state of Illinois that serve more than 1.4 million patients, can be directly tied to the Civil Rights Act of 1964.
And with that being said, with the history of our distrust in seeking help when we need to, get the services provided, how do we go about bridging that gap again? Because I got family members who can be in immense pain, but still are terrified to go to the doctor for the simple fact that they just don't trust a lot of the medical professionals that don't look like them, and it's causing them not to get the help that's needed. How do we go about changing or fixing that within the Black community?
That is the very reason why I became a physician. I heard my grandmother talking, and I've given this talk before. I've given this spiel before, but people who know me know that I'm just slightly nosy. I'm always listening in on people's conversation, but that's why I tell people that's how I got smart.
That's how you got smart.
But I was eavesdropping on a conversation, and when she was saying how minorities don't get the same level of care as white individuals. And if you ask her now, she'll tell you that I got it all wrong. That's what happens when you eavesdrop. But my recollection of that conversation is the very reason why I decided to become a physician, and why I decided that I was going to come and work at what was then Chick Clinic. And I was going to change the system, and I was going to make it to where other people could get access to care. And it didn't matter what their skin color was or how much money they had. No matter what, I wanted to make sure that people got the level of care that they deserve, because it shouldn't be based off of all those things. It's a right that everyone should experience. And so as a result of that, and having an awesome team, because one person can't do it all, but having an awesome team is why you see Crossing Healthcare having the impact that it's having now in our community.
Yes.
And again, I'm not taking ownership for all of our success, because it was a team approach. But when you come to this campus and you see what we have been able to accomplish, it's because we truly believe that your income or your ethnicity should not determine what level of care you receive. And that's what the whole healthcare movement, that's what the community health center movement is all about. And Jordan, he has his own story, and I'm going to let him tell his story as far as his passion with community health centers.
Yeah, well, I just want to echo your comments, Dr. Ray. We need more providers like Dr. Ray. We need to incentivize providers to go back into the community. And I think you're spot on, Terrence. You want to be seen by somebody that looks like you, or at least somebody that you can relate to. And that's exactly what the community health center model does. The community health center model exists specifically to meet the specific needs of their communities. That's why the board of every community health centers, the majority are actually patients of the health centers, the patients that are receiving the services, and the patients that are dictating the operations of the health center. What services need to be added? What should they extend hours? Should they be open on the weekends? What other community services do we need to add? And I'm not just kissing up to Dr. Ray here or Tanya Andrix, who's CEO of Crossing. Crossing is what.
I said, I'm kissing up to him.
You're kissing up? Okay, yeah. Yeah. Crossing Healthcare is one of the best community health centers, not only in the state of Illinois, but in the country. And they have that really robust model of care. But, the reason I really care about community health centers, and Terrence, I'm actually from Decatur. I was born in Decatur. I would come back, even when I moved away from Decatur, would come back and train at MacArthur High School and run with the track team because I went to really small over here. So, my mom still lives in Decatur. My roots are in Decatur. I'll always consider Decatur home, but I was raised by a single parent mom, low income household. She had multiple sclerosis and then breast cancer and really struggled to make ends meet. Thankfully, she had an employer that provided healthcare and healthcare coverage. So, she's alive and well today because she had access to that healthcare. But there's a lot of people that aren't afforded, those same opportunities. And I've been very fortunate in my life to, have a strong mother who had that, healthcare access. So this is very, very personal to me. And actually, when I go visit a community health center or even, other providers, I actually relate more when I'm sitting in the waiting room with the patients than I do when I go in the back and meet with, the president and CEO of the organization, because I've lived it, right? And I know how important it is, and I know how improving someone's life through healthcare can, really set them up for long-term success.
And one thing that I've seen especially just in the Black community, is the disparity of tying your healthcare service to a job, especially in a community where the jobs aren't as robust or in abundance. I truly think that's one of the main problems too, is your healthcare services are, benefits is tied to a job, especially through the pandemic and people losing their jobs, being furloughed and stuff like that.
Yep.
I'm not sure how to go about that, but I know that's an issue, is tying your healthcare benefits to a job. I don't know how to combat that, but I see that as a problem. Um, Now, to you both, what are the most significant barriers to equitable health access and outcomes?
Yeah, so it's kind of simple. And again, I'll use the word again. It's sad. I can only kind of shake my head. I mean, one of the biggest barriers is your skin color and where you're born. The zip code that you're born in can really determine your life expectancy. And the fact of the matter is that some communities just have greater access to healthcare than others, and they have more robust healthcare systems overall. There's also a number of, and we mentioned this terminology earlier, social determinants of health: housing, employment, like you just mentioned, Terrence, income, transportation. If I don't have transportation to get to a healthcare provider, I don't have access to a healthcare provider. And we think that everyone has a car, and no, that's not true. We need to provide access through transportation. Another example of a social determinant that we're starting to realize even more is connection to legal services. So I was reading a Chicago Sun-Times article last night about these public housing residents, and they're next to these toxic waste sites, right? And they're developing all these chronic conditions as a result of these toxic waste sites, but they don't have the means to fight it, right? They don't have an attorney. They can't go, hire a high-priced attorney. So what we're starting to do now, community health centers, is we're partnering our patients with free legal services. Now, let's say you're a public housing resident and there's black mold in your house. Obviously, that's detrimental to your health. How are you going to address that, right? You probably need to get an attorney. We could connect you with an attorney. But, another sad fact is that there's so many people now that have a limited amount of resources that they have to choose between: am I going to take care of my health, or am I going to pay for food for my family? Am I going to keep a roof over our heads? Am I going to be able to keep the lights on? So, those are really the barriers right in front of you.
And that leads into my next question: is the role that community health centers play in achieving health equity. I see now that it's more so genuinely taking care of the people and what's blocking them. Like you said, now with the legal, I even I even think about the legal ramifications if they're living beside toxic waste or mold. Um, on top of that, what role does the community health centers play in achieving equity? What else contributes to that?
So I'll
Dr.
give
Ray?
a broad I'll give a broad
Ray?
answer, turn it over to Dr. Ray, and she could probably share some specific examples of crossing healthcare. But broadly is understanding that a person's health and taking care of that person doesn't exist within the four walls of an exam room, right? It's not just getting your exam and, you know, taking some tests and getting an immunization and then you're out the door. It's connecting them to those other vital services in the community that's going to impact their health. Let's think about food, nutritious foods, right? Access to food banks, employment, connecting your patients to jobs. I know there are a number of health centers that have job programs. I can think of one health center that has a substance use disorder treatment program, and once those patients go through the program, they hire them actually at the health center and give them a decent wage. It's actually incredible. So I just say broadly, it's taking care of the whole person and not just physical health, but mental health, connecting them with medicine, connecting them to housing. Again, it's not just you come into my health center and you're out the door and I forget about you. It's taking care of you every single day out in the community.
Oh, I love every bit of that. Now that's what I
Well,
love to hear.
and you know what I love about that? That health center he's referring to is Crossing Healthcare.
Hey! That's what I'm talking about.
So that was just even perfect. Jordan couldn't remember the name, but I remember it. But
Yes.
that's what health centers do. And so when we look at it, we're talking about a holistic approach. So it's, as Jordan was just stating, so it's not just about your medicine and you coming to your appointment and me giving you this prescription, but it's about, okay, if you don't have access to food, guess what? We have a food prescription program, a produce prescription program. So if you're diabetic, hypertensive, have substance use disorder, your kids are overweight, you have obesity, we have a program set up so that on Fridays you can get fresh produce. But it's not just about giving you that fresh produce, it's telling you how to cook it. So preparing you or empowering you so that you can make healthier options easier and making it a choice and not something that you know, making it a choice and making it easy to do. And so that's one thing I want to really credit our dietitians with doing, because it's not just about creating this program about giving out the produce, but let me tell you how to cook the produce. When we talk about other aspects of it, you know, we have quite a few patients who are overweight or who are diabetic, but they couldn't receive some of the services that are available at the hospitals because they didn't have commercial insurance, or they had transportation issues. And so I challenged our staff, let's come up with a way to offer those same services here. We are now ADA certified to be able to have diabetes education classes here. We have a weight loss program called Lose to Live that is going on, and they meet and talking about how they can lose weight and do it in a healthy manner. We have a 6-month program that you can go to just learning about diabetes, small group, having that accountability to help make you, to help give you the tools to be more successful. We have chaplains on staff because we know that your spiritual care also affects your physical care. So how can we meet your spiritual needs outside of what we're offering? We have behavioral health staff on site. So that's our therapists and counselors, as well as psychiatry, to meet those, to address those issues as well. So when we're talking about taking a holistic approach, it's every aspect of that person being. We're doing a study now on trauma and how that is affecting our patients, because for a great deal of our patients who are entering our door, what they're concerned about is not what news I'm going to give them, but it's about all the issues that's going on at home, all the issues that's impeding them from making the best decisions. And so now we're looking at that. We're setting them up with mentors in our community so that, again, we can give people the best health outcomes possible. And so, you know, one of the things I think about is that graphic that was done before, talking about equality versus equity and how that looks. So we're trying to help make services more equitable for our patients, not just equal.
All of that is powerful and it's needed. Super powerful.
Yeah, I told you crossing healthcare was one of the best, health benefits.
That's a fact.
One thing that I noted earlier, Terrence, and it's back to your question about people having healthcare access and health insurance because of their employer, and as you rightly noted, there's a lot of unemployment out there, is that we are charged with serving anyone regardless of their ability to pay. And I think a lot of people that don't have health insurance, they're just afraid to even go access healthcare. But you go and come into a community health center, the first thing we're going to do is try and connect you with health insurance if you're eligible for health insurance. And if we can't and you can't afford it, we're still going to treat you. We're still going to take care of you because we believe strongly that healthcare is a right and not a privilege.
Yeah, it's just something in the Black community. We're just
Mhm.
throughout history, the things that have been done to us, it's hard for us to trust anything, let alone going into a health. And then when you hear all the time about health insurance, you got medical insurance or what have you, it does deter. Even before I got insurance, it deterred me as a young man to go and get a yearly physical, what have you, because you believe uh, falsely in your mind that I won't be able to walk in there and get services,
Right.
and that's
And
just
then even, understanding insurance. So you get access to insurance and how to utilize it. So even for my own health insurance, I get things in the mail and I read it, and it's complicated to me. This is my job. This is what I do every single day. If it's complicated to me, what is it like to someone who doesn't work in healthcare? I try to empathize as much as possible, put myself in someone else's shoes. If I don't understand it, then I can't expect someone that doesn't live this every day to understand it.
it's definitely they do that on purpose to
Yeah.
confuse you and to
Don't get me started. Don't get me started.
that's a whole nother podcast.
Right, that's right. Yep.
All that gibberish is just to confuse. Now with COVID-19, okay, now we have people who are adamantly protesting to go out there and just spread it. Now, what racial disparities have you seen as a result of COVID-19 within your personal facilities and what you're doing?
Yeah, so it's been, you want me to go first?
Yes, sir. Go ahead.
All right. So on April 17th, we announced a partnership with Governor Pritzker to expand COVID-19 testing statewide. So to date, we have 125 testing sites. We tested over 300,000 individuals. That's on the low end. And what we've seen in Black and Brown communities are really high rates of infection. So a couple of those for you. African Americans make up just 15% of the population in all of Illinois, but represent, I think it's 28% of actually COVID-19 deaths. For Latinos, 17% of the population, 33% of deaths. And what we saw when we started testing more, in some communities, the positivity rates were 60 to 70%. So 6 to 7 people out of every 10 that were coming in were testing positive for COVID-19. Now let's go back to earlier in the conversation when we're saying that African Americans are more likely to have heart disease, diabetes, hypertension, okay? These are significant factors that can impact your health already. You add COVID-19 to it, right? You're more likely to be impacted, greater, more likely to pass away because you already have these underlying conditions. So that's, what we've seen across the state.
Yeah, I mean, Jordan summed it up very nicely. There isn't a whole lot more that I can add. Crossing is one of those sites where you can come and get testing as well. And so for us, when we look at the social determinants of health and how it's impacting health outcomes, and its relationship to COVID, it's how can we get people to decrease some of those risk factors? So how can I help you get your diabetes under control or lose weight so that you don't become diabetic? How can we get your high blood pressure under control? Because those risk factors, those chronic diseases is what's causing the increased death rate in the minority community. And so one of the things that I discussed earlier, I did a conversation earlier in a month or a couple of months ago with a non-for-profit. And we discussed how really up until 10 years ago, after the Affordable Care Act came into existence, did we end up seeing some decrease in the health disparities in African Americans and Hispanics. And that came about due to increased access to healthcare. It also came about due to more individuals being able to get enrolled onto Medicaid. And again, community health centers picking up the slack by expanding services so that we can meet that demand. Now we're just now starting to see some of those health disparities starting to narrow, and then you throw COVID on top of this, and it just emphasizes why we need an improved healthcare system. And this goes beyond just about a community health centers. This goes into politics. This goes in, healthcare should not be a debatable option every 4 years or 2 years in some instances. It should not be politicized. It should be something that everyone should have access to, and it shouldn't matter where you live or how much money you make as far as what type of level of care that you have.
And that's something that is super important, especially in an election year. People always like, don't get political. This has everything with, you can't talk about disparities within the Black and brown communities and not talk about politics. You know, this is the time when it's time to have those uncomfortable conversations, and politics has everything to do with it. You know, these are the policies and procedures that, like you said, we shouldn't have to have a debate about everybody getting the same great health care without the discrepancies, you know.
Right. Right. And, you know, I realize that the Affordable Care Act is not perfect, but it's a good start. And so when we talk about seeing, going back to where we used to be 10 years ago, you know, 10 years ago, I had almost 30% of my patients who didn't have any insurance. And I spent a great deal of my time on the phone asking hospitals if they had charity care for my patient so that they can get the CT or the test that needed to be done, or that they can end up getting a referral to a provider. When you look at how many individuals who end up going into bankruptcy related to healthcare related costs, it's astronomical. And so we end up increasing the divide between the low and medium as well as high income individuals when we throw in there now expenses related to healthcare and going bankrupt due to my healthcare costs.
Yeah, and it should never ever be like that. Ever, never. You should never go bankrupt trying to get the services that you need. And with that, I want you guys to elaborate on what your individual places are doing. How can people get in touch with you and what you're doing through this crisis, this pandemic? Jordan?
So I think, you know, people that want to learn more about community health centers and learn more about our organization and what we're doing can visit us at iphca.org, this side, iphca.org, or find us on our social media channels. On our website too, you can locate a health center. So some people may not know, you know, where a health center exists. If you're from the Decatur area, you know Crossing Healthcare. But as I said, we have 390 locations throughout the state, and we have 125 testing locations right now that you can find on the Illinois Department of Public Health website. But I wanted to touch on too, you know, what we're doing and the mentioning of politics, right? If we're focusing just on healthcare, okay, healthcare policies are the result of legislation and regulations that are passed or decided by politicians. So obviously it's very political. And so one thing that we did this year, and Illinois is taking the lead, is we worked with our legislators to invest $240 million in Illinois' community health centers. And that's because our legislators, our politicians recognize the value and the impact of community health centers, because when we really take care of our patients, we really take care of our communities. There's a cost there, but I would encourage people to think less of it as a cost, but more of it as an investment, right? We are keeping people healthy. We're keeping people out of the emergency room. You don't want to go to the emergency room. If you're listening and you get sick and your first thought is to go to an emergency room, I'd encourage you, please don't do that, right? As soon as you start feeling sick, go to a community health center, okay? They're gonna take care of you. Don't wait until it gets too serious and the next thing you know, you're in the hospital. So these investments, as I said, lower healthcare costs, which is better for everyone. There's no one that can disagree with it, right? We know that community health centers in Illinois save the state on an annual basis $2 billion with a B, billion dollars by doing what I just said. Again, it's that fully integrated model of care that treats the entire patients, whether they're in the health center or out of the health center. And what is the first thing that health centers did during COVID-19? The first thing that we did was we got on the phone, we got on our Zoom, and we said, how are we going to address this for our communities? And we started immediately setting up testing sites with no clue if we were going to be reimbursed for it or not, because that's what community health centers do. We answer the needs of our communities, and we're thinking about our patients and our communities first, and not what we're going to get paid for it. So I think that's just a high level view of what we do in general and what we've been able to do since early March with the with COVID-19.
And so with Crossing Healthcare, if you need to get in touch with us, you can go to our website at crossinghealthcare.org, or you can also give us a call at 877-9117. With Jordan, I got several ideas from some things that Jordan was talking about, but one of the things that Crossing Healthcare did in order to meet the need in the community with the pandemic is that we changed our hours. So we went to 7 days a week, 8 to 6 p.m. when the shutdown was put in place. And that's because individuals, we knew that there were a lot of individuals who were delaying care as a result of the pandemic. They were afraid to go to the emergency rooms, and hospital utilization decreased significantly. And that's when community health centers or your primary care physician needs to pick up the slack and meet the need. We did that. We made it easier for patients to just walk in. We also had phone visits available for people. For individuals who had respiratory issues that it may not be safe for them to be around other individuals, we had it to where it was curbside care. So you can do curbside, getting your diabetes and hypertension meds and checks, as well as respiratory clinic that was curbside. And we even had curbside labs. So you didn't even have to come in and be exposed to other individuals in order to get your labs drawn. This is what community health centers do. We are very agile so that we can meet the need of the community. We can't just be real restrictive in meeting that need, but we need to be fluid. And that's what Jordan just alluded to as far as what we were able to do as a result of this pandemic.
Okay, before we wrap up. Oh, go ahead, Jordan.
Now, Dr. Ray just gave so many more ideas. And one of the things I was going to say is when we started testing patients, we had this model, you drive through, a lot of people aren't willing to see their doctor. They're afraid to go out, but they come out and get a test. So we're going to see them curbside, right? It's still important that they're taken care of. It's still important that we're treating their chronic conditions, whether it's diabetes or hypertension. And for those that aren't comfortable with coming in, we expanded our telehealth options. So you can have telehealth visits, you can have Zoom visits, and we're still taking care of the patients. And so when I spoke with the governor's office about this model and wanting to expand testing statewide, they loved the idea. It was really a no-brainer because we also exist in some of those hardest hit communities that have been disproportionately impacted by COVID-19 throughout the state.
Right. And the issue is some of these services, they're available for the commercially insured patient, but they weren't available for Medicaid individuals. And so with IPHCA and their advocacy, they end up expanding those services to individuals who previously didn't have access to this. So before, I could never offer a telemedicine visit. That just wasn't an option. But because of IPHCA and their advocacy, and getting the rules changed during this time period is when we were able to offer these services to our patient. And we did it in a fairly quick manner.
You guys definitely did. Before I let you go, any last words? Once again, you guys are doing a phenomenal job, like phenomenal. I'm blessed to have you guys in, not just on my show, community that you serve. It is so important and it's needed. It's definitely an essential piece in us combating the disparities that exist. But some final thoughts or words before we close. Ladies first, Dr. Ray.
Basically what I would say as far as closing thoughts, healthcare should be a right that everyone is able to experience. It should not be a privilege. It should not be based on your zip code or what your educational level is or any of those other factors. The one thing that you can do that is going to be most impactful is to allow everything that's taking place in our community right now with the racial unjust, with the racial issues that are occurring, with the issues with the pandemic, is to be more of an advocate on how can I make it to where everyone has access to healthcare and it is not related to politics or, again, any of those other factors. We need to speak up and speak out.
Hey, now, you better tell it. You better speak up and speak out.
My career is based on doing that for the medically underserved, and now it needs to take place on a more national and global level. So you can do something. You can be a part of the solution and not part of the problem by speaking up and speaking out.
Hey, look at that. You need to be preaching somewhere. And Jordan.
I don't know if I can add much to that. As an African-American male, I mean, this is, a very interesting time for me because I've experienced racism even recently. I mean, I'm 35 now and, I've been in my role now for a couple of years. And, when I became president, within a couple of days, a guy asked me if I got the job simply because I'm Black, and so all this that's going on right now is very personal for me. Obviously, healthcare is really important to me. And I would just say, to those that are watching or listening, is that you have to keep the momentum going. And it's one thing to just say words, right? There needs to be action behind those words. And I think sometimes in our country, we can be easily distracted. And so right now we can focus on addressing these issues, and then a couple weeks later, we kind of forget about it and we go back to our, regular lives. We have to keep the momentum going. I can tell you at our organization, we are taking our time to come up with a definitive plan to address racial, social, and health inequity. And those that are interested in keeping up with our organization, again, can find us on all the social media channels or at iphca.org. I think the last thing I'd like to say is, most people I come in contact with, like Dr. Ray or Terrence or, my neighbors, most people want to do the right thing. Most people want to come together. We know what we need to do. We know what we need to get done, and not to be distracted by some of the divisiveness that we see. 98% of the people that I come in contact with every single day want to do the right thing. So let's not let those outliers distract us or divide us. Let's stay together. And let's follow up our words with definitive action and not lose sight of bringing equity into not only healthcare, but in every aspect of our lives.
That's what I'm talking about. That sums it up. Period. All right. Continue to do the right thing. You guys are fighting you're doing God's work for sure. I want to thank my beautiful, wonderful, phenomenal panel, Dr. Ray, and the president, CEO himself, Jordan Powell. Thank you guys for joining us this week. I am your moderator, Terrence Tat Taylor. Remember, you can catch Speak Up, Speak Out every Saturday at noon on Hot 105.5's Facebook page, on the nondecatur.com as well. But you can also join into the conversation at any time. Like Dr. Ray said, speak up, speak out, and speak proud and loud. You can get in contact with us at speakoutdecatur@gmail.com. Make sure you're speaking up. Whatever you want to talk about, we're here to serve. Thank you to our sponsors again, Crossing Healthcare. Big ups to Crossing, the Community Foundation of Macon County, United Way of Decatur, and Mid-Illinois, Newhoff Media in our great, wonderful city, D-Town, where we stay down. Decatur, stand up. And last thing before we go, please speak up and be counted. The census is critical for our community to receive funding for everything from job training to better schools to better health care and important services like food distribution and housing assistance as well. So make sure, if you have not already, please, especially in the Black community, I've told you we got a lot of trauma. Trust and believe we have to be accounted for. It takes 4 minutes to complete 9 questions, easy questions. Go to 2020census.gov and be heard. Thank you again, you guys. Stay blessed, beautiful. Until next time.
Every 10 years, the U.S. Census gives communities across America the chance to get the funding they need. But there's a catch. The money is based on counting an accurate number of residents in each state. The fewer people we count, the less money Illinois gets. Illinois has received nearly $60 billion from the federal government based on numbers from the last census. Every person who doesn't fill out the census means less money for Illinois. That's money we could use for new school programs to help our children thrive and succeed, for building new bridges that would help you travel safely on your morning commute, for paving roads and ensuring more reliable public transportation, and for improving our hospitals and clinics so everyone gets the best health care. In Illinois, we deserve our fair share, and it starts with all of us being counted. Visit my2020census.gov or text 987-987 to learn how you can fill out the census today.